Now, before we went on break, we were talking about, government and the role it needs to play to plug gaps here and there. But back to you, Chukwuemeka. You see, beyond government intervention, with what role can partnerships with the civil society, the media, the private sector play in driving community-based solutions and behavioral change?
Thank you so much. I think that's an interesting angle. Partnerships, the role of partnerships can't be overemphasized, whether it's public-private partnerships or partnerships at the community level. For instance, at the private sector, we know that almost 70% of healthcare delivery happens in private facilities, right? So you can't ignore the, such stakeholders, critical stakeholders in this regard. You have to leverage the strengths of both sectors. Now, coming to the community level, like you mentioned, one area that we've seen that has been lacking, like you had asked previously, is how we leverage our understanding of cultural norms, right? And how this, impacts the perception of healthcare delivery and also access to healthcare delivery. So, for instance, aligned with the theme of this year's World Health Day around maternal health, we've seen situations like where pregnant women, refuse to receive care because a particular song isn't sung to them when they want to give birth in the hospital, so they prefer to go to the traditional birth attendants because they understand how they should be approached and how it should be made fun for them. We've heard that, and we've seen that these things come out when you go closer to the communities to understand how healthcare is delivered at that level. I'll give you an example. In Nigeria Health Watch, one of the key things we are very keen on is really generating evidence on how healthcare is delivered at the community level. Thereby, you now use that evidence to engage with policymakers, to really present that evidence, amplify community voices on their pain points and critical issues that are driving low access to healthcare. Thereby ensuring that the policymakers and the executive of the state can also pay closer attention to these and address these issues. You also look at, when you understand these cultural norms, you're also able to improve awareness, right, in this regard, engaging them in the language in which they understand, right? In terms of also public partnerships as well, partnerships goes a long way in improving health insurance, for instance, right? So Professor Nasidi mentioned how the MAMI initiative, how private healthcare providers can also be part of that, those that provide those care and also get remuneration from the government in that regard. So if you can't ignore such critical stakeholders in this regard. So then you also look at public-private partnerships in terms of improving efficiency in healthcare delivery. Private providers have the strengths of bringing state-of-the-art facilities, right, in delivering healthcare. So you have to also understand how that can improve the efficiency of healthcare delivery through things like mobile telemedicine, mobile health, digital health services, digital medical record keeping, and how digitalizing our health facilities record, right, can also improve documentation and the use of evidence, right, to inform healthcare delivery. So it's really important to understand what strengths exist within the private sector, both at the national level, at the community level. A lot of organizations, both CSOs, private sector organizations, operate at the community level. And you want to leverage as much of those resources and ongoing programs to ensure that they all build on one another. But I think I'll wrap up by saying that it's also important that while we improve these public partnerships in this regard, it's also we like that the last year there was a landmark policy initiative to give local governments autonomy, right? I think at this point we should be thinking around how that autonomy can improve healthcare delivery and accountability at the local government level. We've seen that Algon has started to take shape, absolutely, right? Yeah, so we need to also see how local governments, when resources are channeled through the local government, right, how they can now be, the influence and the power can be decentralized, and we are held more accountable at that level and not just at the
Yes,
federal level.
I think I was at a meeting where the minister had conversation with some members of Algon, and they pledged, of course, to partner in that aspect.